Welcome to the Disruptive podcast by Minority Innovation Weekend. Minority Innovation Weekend is a weekend summit dedicated to aiding minority innovators launch tech-focused startups, exploring emerging technologies, and showcasing tech startups that have a minority founder or co-founder. During each episode, we will discuss innovation, news about tech startup, as well as the startup ecosystem, and interview people of color throughout the startup ecosystem. Welcome to the MIW Disruptive podcast, featuring and hosted by Michelle, Sir Walter, and Jerome. Today we have a special guest. This woman is a public health advisor for DC Department of Health. She's also the co-chair of the Blockchain and Healthcare Global IEEE Research Subgroup Committee and fellow, as well as an adjunct professor at George Washington University. I am talking about Dr. Tiffany Gray. Welcome to the show.
Thank you. Thank you for having me.
Welcome, Tiffany. We're really excited to have a conversation with you. I think it's a very timely conversation. So I'd love to get us kicked off. I would love to learn a little bit about the work that you're doing, that you're spending each and every day. I think you have a really eclectic background, someone who is a scientist, and also an academic, but an entrepreneur as well. Can you tell us kind of a little bit about the work that you do at a high level?
Sure. So the majority of work is my main, bread and butter is I'm a public health advisor with the DC Department of Health. So my day job, I work as a public health advisor for our tobacco control program. So a lot of my research and background has been in tobacco use behaviors and patterns in various populations and groups. My main group of interest is adolescent use, and looking at a lot of the disparities around tobacco use in communities of color. In the past year, you've seen a lot of information or a lot of news around vaping, for example. So just really working with the agency to really sort of steer a lot of our communication and messaging and prevention efforts around tobacco use in various communities, as well as looking at mental health and some of those other related factors and underlying factors that play into different health behaviors. So I have a master's in public health in maternal child health. I have a doctorate in public health in health behavior, both from George Washington University. And then I do a lot of consulting work for a variety of organizations. I'm a new global ambassador with Patientory Inc., which is a blockchain company based out of Atlanta, Georgia. So I'm very excited about getting to work with them. And as you mentioned, I'm a fellow and research subgroup advisor for Blockchain and Healthcare Global as part of IEEE. And the goal of that organization really is to start having discussions and steer the direction for industry standards around blockchain and healthcare and other technologies and emerging technologies in healthcare as well. And then really starting to think about and pinpointing a lot of those key ethical challenges and questions and getting the key stakeholders and individuals at the table to start thinking about how we can really start putting some policies or thinking about the policies we may need as these technologies continue to grow in use. So I made a long laundry list, but basically I just help, really be the person at the table to really say the technology and all those key questions around that is is important, but let's think about how this will impact people and impact the population and really have an impact on people's lives.
All right, I have a question.
Sure.
As far as I guess what's the biggest connection between like blockchain and healthcare? Like, what is a use case that is, I guess, new and most exciting to you?
So there's a couple of different examples. I mean, the biggest example we could use right now is COVID-19. in addressing the pandemic response. So blockchain could be utilized as a way, and has been utilized as a way, to manage the supply chain, and efficiency and transparency in the supply chain of supplies, whether that's personal protective equipment, pharmacy, pharmaceuticals, drug supply chain. There's the FDA, I believe last August, launched their blockchain pilot use cases. So there's a couple companies, I'm blanking on how many, I think about 4 or 5 groups that are testing out application of blockchain technology to better manage our drug supply chain, to make sure to reduce fraud and mismanagement of pharmaceuticals, as well as managing costs and distribution as well. So those are some of the really interesting use cases. Right now, Patientory is utilizing or looking at ways to, again, look at how blockchain and that's a really more recent use case of how blockchain could be utilized in a broader sort of public health scope. Again, managing a lot of the data flow. So one of the biggest challenges or really important pieces of the COVID response right now is management of data. Everybody wants the data, right? But it takes time. You still need a lot of, right now I'm on standby for potential contact tracing for the Department of Health. And, those are really important. That takes a lot of manpower. But data could be a way to make sure that we are collecting adequate information. We're getting that demographic data that we need to really see which populations are being impacted most, hotspots, things like that. So that's one way that blockchain could be utilized to manage flow of data and information, and then make sure that there's transparency there. So it's used in a variety of different health systems. And again, that comes with its own challenges. Health systems use various, ways of collecting information in electronic health records. That's where a lot of use cases are being examined. Challenges there are interoperability. People have different systems, and making sure that all those systems can talk to one another, etc. There are others who could really get into the weeds of that, but that's sort of the gist of how blockchain could be used in some of those really high level, sort of really interesting use cases that are happening in healthcare right now.
All right. So if we could take a little step back. So like in layman's term, can you tell us a little bit about what big data and data science is?
Basically, big data is just really large data sets. That's pretty much really large, complex data sets. And data science is sort of, and go hand in hand. It's basically the analytics and analyzing these big complex data sets. So that's really what, and using that information to turn it into digestible information that's useful in many different ways, whether that's helping us identify and do modeling for the curves, right, of understanding curves, and sort of being able to forecast when our peaks will hit in certain locations. So that's, again, big data. Big data could be, cell phone data, the information that we churn out on a day-to-day basis. That could be used for, consumer data is another big, large, sets of just really large information. Yeah.
Yeah, so another question that I will kind of ask is around blockchain. I feel like that term was super sexy in like 2017 and 2018, and everyone was talking about how blockchain was going to solve so many problems. So could you, in a way that is folks can understand, to like the everyday human being, kind of explain what blockchain means? And then can you kind of provide some examples of how people started focusing on the real uses of blockchain instead of like fixating on the Bitcoin hype that was out?
Right. So I think with blockchain, I think that is the biggest sort of challenge. Everyone's tied blockchain to cryptocurrency, right? And so that's, when people think like, well, why is blockchain important, or how can we use this? Again, blockchain is essentially the technology that makes cryptocurrency work, right? It's this ledger that is distributed. It's peer-to-peer, and again, you can see sort of the transactions, right? So you can see every transaction that's taken place. So if I send you, we have a group text message. This is usually the way we try to explain it. It's group text message, right? And say, you sent something you didn't mean to send, you delete it. With blockchain, you can see that it was deleted, but it's still there on the chain. It remains there, right? So that's where that transparency sort of piece comes in. You're able to see every sort of transaction that takes place. So blockchain is essentially just it's the technology that enables the use of cryptocurrency and blockchain. And again, cryptocurrency was sort of the main highlighted use case that everyone sort of, thinks of or is most familiar with. In regards to the hype, I think it depends, right? So I think there's still many of those who are still very hardcore cryptocurrency, hardcore Bitcoin. People are saying, see, this is why we need more digital forms of, currency, in times like this. And I think it's very, you get, it varies, right? So it's not one size fits all. And I will say that again with blockchain is, I like to say, a useful tool. So not everything needs blockchain. Not everything needs to be put on the blockchain. One of the biggest challenges with blockchain technology is that it uses a lot of power, right? So it takes a lot of power to run and to utilize. So there's an energy issue and just, again, storage issue when it comes to utilizing blockchain as well. I think specifically in healthcare, I think it's different in that we really have been trying to think about real useful ways in which this technology can be utilized. There's Jose Arrieta out of HHS, who was able to implement blockchain in automating some of their systems there and has been very successful in doing that, right? And again, I mentioned Consensus Healthcare is another organization company that's it's headed up by Heather Flannery now. The healthcare division is headed up by Consensus Health. And they really are thinking about those real, true use cases that we could utilize this technology where it would be most beneficial, right? Because again, I think one of the biggest challenges is everyone wants to sort of put everything on it. Like you have a brand new idea, let's put blockchain on it. That's not how this works, right? And so that's sort of where I come in as an advisor of, again, not necessarily building the technology itself, but really helping people to sit down and say, okay, let's really take a real deep, look at what you're trying to do, what your goal is, and whether or not this is something that really needs to be used, or if there's another method or another route that you can take, or in order to help, achieve your main mission and goal, right? So I think that the conversations are definitely still happening. People are really, but I think we're starting to move into those real testing of specific cases. People are really taking a step back and really thinking about whether or not this is something that you actually need to use. Again, like the FDA pilots are really great because that's really a good use case to really see. It's building upon the long-standing, blockchain's been around for a really long time. Again, cryptocurrency, Bitcoin was a way to kind of highlight and bring it to the forefront, but it's something that's existed for a very long time. But really, as we are more concerned as a society about, the opioid crisis, or, the management of the increasing cost of pharmaceuticals and things like that, really identifying sort of, where our supplies coming from and where it's being distributed, how it's being managed. I think those are some of those really good use cases that can help people better understand how this technology can really be helpful. Healthcare systems, again, are, as Dr. Fauci and Dr. Birx and everyone in public health right now has mentioned, that COVID, our current pandemic, has really shed a light on what we as public health researchers and practitioners have been shouting from the mountaintops for years, of the huge disparities in health and healthcare, and the needs of our systems, especially those in rural areas or underserved areas. The shortages of PPE have been something that we've known for a very long time and have with the growing increase in cuts to funding for research and for health, this is what you get, right? And then everyone is, we don't have enough information. We don't know what's going on. And, I urge everyone to really know that science takes time. We have people working around the clock trying to understand this virus, trying to understand the way it spreads, trying to make sure that we are sharing the most up-to-date, adequate data that we can to inform the population, inform individuals. But we as humans have to do our parts too, and listen to those that are sharing this information. But yeah, so it's again, there's a long ways to go, but there are many in the field, in the area, that we are really working together to sort of really have these discussions globally about how we can really move forward with this technology, specifically in the US as well.
Thank you.
Dr. Gray, if I were to, or someone's setting up a decentralized network for healthcare supply chain information, is there a technology or a infrastructure or a type of blockchain technology that's better served for healthcare than, say, from any other application?
That I can't necessarily speak to. I know there's some who can speak much better on, which system is much better, Hyperledger, Ethereum. So I think it's going to, I think it will depend on the type of system or existing system that healthcare system has, and which one will serve that system's needs. So someone coming in would assess sort of the existing sort of gaps and pain points, the type of information, how many patients you have. Are you a larger system versus a smaller clinic, for example? Who's going to be sharing information, or how you're going to be sharing your information across the board. That can also influence the type of systems. But I know that there are some systems where, it's public versus private, whether you're going to have a public blockchain versus a private blockchain. Those are some of the key questions that are often brought up and considered when choosing a system to use. And again, privacy is a huge factor. And even with blockchain technology, as much as we want to say it's more secure, there's always going to be privacy and security issues that have to be taken into account as well. So the question is, it's really going to, there are some who are more one versus the other, but again, it's really going to, again, I can't speak too in depth on it, but it would really depend or vary depending on the existing system and the needs and capacity that the system has, or a healthcare unit has.
Thank you.
So there are ethical questions in regards to artificial intelligence in healthcare. So who is responsible when those decisions are made, and who or what will provide the oversight?
I mean, that's the ongoing question. I think when it comes to the sort of who's in charge, it's a collaborative effort. We have to have everyone at the table. It's going to take policymakers. It's going to take the leads of these systems and organizations that are going to be implementing are looking to use AI, especially if you're thinking about a healthcare system. It's going to take all parties. You're going to need your staff. You're going to need the patients themselves, the consumers. That I think a lot of time we forget that we are, we as the consumers are just as important to these decision-making processes as well. So it's going to take lawmakers, policymakers, those of us in public health, those of us in healthcare, insurance industry, other aspects of health, and those involved in the delivery of care to really be involved. And again, it's one of those questions. I actually just did a module for University of New Hampshire Law School, and I had some guest speakers, and we were talking about these key questions. I posed that to my speakers, and again, it is very much so a collaborative effort. And that's what, we as Blockchain and Healthcare Global, for example, are really starting to think as an organization to really highlight and bring up some of these key questions when it comes to utilizing AI or utilizing blockchain. Because one of the things is, we, especially, and also the developers, right? So we can have a discussion about implicit bias. We all have our own personal biases that, as we're developing these tools, can sort of filter in to the development of these products. And as this machine begins to learn and adjust, it's going to start kind of making decisions based on those biases, right? So it's, there's concern about, AI, for example, in sort of screening tools, right? We've seen challenges there already. So making sure that people who look like us and look, from diverse range of backgrounds and populations, everyone needs to be at the table when we're talking about utilizing any of this technology at any level.
So taking a little pivot, but also taking the conversation from being a public health advocate and professional to the global pandemic, that especially in the United States, as numbers are coming out, we are seeing that this is impacting and infecting and killing Black communities and communities of color and low-income communities, right? And then also taking entrepreneurship and innovation. So what are you seeing as someone who has worked in public health care, who is passionate and has ensured that people of color and communities of color are at the table at these important conversations, and who also is an innovator? Like, how are you seeing innovation come out to deal with this pandemic?
When it comes to innovation, I mean, I think a lot of this is actually, Patientory, again, is at the forefront of really using their resources to be able to address the issues of the virus and tracking and tracing and providing up-to-date data as best as possible. We're seeing, I'll shout out the Black ladies in public health, headed up by Jasmine Ward. They've started a data dashboard that you can go and see sort of the cases, and they're, condensing information in a way that people can access and is made accessible to others. So that's, one key thing is, folks like myself, we are sharing education and sort of making sure that one of the biggest, I guess, stressful and most frustrating things is just this level of misinformation that's being spread. And that's a byproduct of social media. I mean, people can click and click, and, all kinds of things get shared. And so taking, a step up and saying, hey, this is what's actually happening. And this is actually what's going on. Because a lot of times we get wrapped up in our emotions, right? And so just really taking a step back and having that sort of neutral stance of, this is actually what we're seeing and this is what's happening, so that people can understand. But, a lot of entrepreneurs are using this time to build their brands, and using this off time to, really kind of shine in their skills in whether it be entrepreneurship, or whether it be science, or whether it be health. When it comes to innovation, Consensus Health, as I mentioned, they're doing a hackathon. So you have a couple people, or that's the one that I know of, but I'm sure there's others going on at university settings. Universities are really, I know my own university is getting really involved in being able to share information and disseminate information. They're working directly with, there's a lot of partnership building going on right now, across various agencies and groups and organizations, because, at the end of the day, things still have to keep running, so it's great that innovation is occurring, but we, still have to make sure we're delivering services, and people are still, my colleagues are still making sure people can get their SNAP benefits, their WIC benefits, their unemployment benefits. It's, they're backlogged. So it's just, we're strained as a system right now. But, there are individuals out there who are really trying to think about ways that we can really be innovative. A lot of it, again, centered on, sort of providing improved telehealth. Telehealth has really been something that has increased just because we can't have, as you know, just because of the capacity levels of our systems right now, we can't have everyone coming into the office unless it's an absolute emergency. If you have an emergency, I'll say this, you can still go to the ER, but that's serving as a front line to deliver those regular physical appointments, or if you break something and you need to, you know, it can assess whether or not you should really go seek additional care. So, you know, that telehealth and telemedicine is something that is really, really helping to make sure that we still are providing some level of care, some level of services. Teletherapy is another tool that's being utilized right now. So everybody's making adjustments. So I think everyone's having to get really creative and innovative right now. But yeah, we're seeing that across the board. And so these were tools that you can think of that were in place, or we were testing to see their effectiveness. And now this is, you know, no longer just a case study. It's just happening in real time. And, you know, we're going to be looking at this situation over the next couple of years of using it as a baseline for how we can improve and change health. And it's going to help us just, you know, really decipher sort of our needs and where we can make adjustments and where costs need to be sort of reallocated and, you know, moving forward, etc. We hope. But yeah, so, you know, and one of the other big challenges is when it comes to research and science is a lot of things are on hold. You know, students, you know, who are in the middle of dissertations, or I mean, I wasn't necessarily a bench scientist, but you know, my data was more of, I could collect it in a different manner. But if you are someone who is having to go in your lab every day and you can no longer go in your lab, that's a huge, huge disadvantage to our field and to science, and it hurts us, and it's going to hurt us for a while. But you know, it's going to be, this is having such a huge, deep impact in so many ways.
Dr. Ray, when we're talking about telehealth, is there a way that AI could enhance that experience? Are there any AI tools out there already that, or some work that someone's working on that may make that a better application?
Not that I'm clear of. I know IBM does a lot of work around AI and machine learning, and they've used that again in a lot of ways for data capturing, data reporting. So that's what I can think of when it comes to AI. Not really sure off the top of my head, but I know those are some of the IBM consensus. Those are the big sort of companies looking at AI in healthcare in ways that we could really improve delivery of care. Whether it be, I guess AI is being utilized in sort of screening tools. So, you know, when you, before making an appointment, sort of asking sets of questions and sort of deciphering sort of the types of needs that an individual, you know, may need, or if you need to seek care. So I guess AI is sort of being used in that way right now, if I'm not mistaken, but those are some of the ways that it's being incorporated in healthcare. Yeah.
Thank you.
So we also, you also wrote, I believe, 2 articles about the Entrepreneurship Diet.
Yes.
And you mentioned that the hardest part of being an entrepreneur is keeping your mind, body, and soul healthy while running a business. Can you talk a little bit about how to balance these things in normal times and during a pandemic?
I think some of my biggest strategies, which sort of can go across the board, I think is, again, sort of really understanding what you need. I think one of, you know, everyone's needs are different. Some of us, I think what's changed now for a lot of us, we're working from home. Some of us have families. Some of us are caregivers. So the balancing act can be really difficult, right? I think some of the biggest things that worked for me and worked, you know, and prior to all of this is, again, trying to establish a routine for yourself, not someone else's routine, but a routine that works for you and fits your life. Okay, so, you know, one of the strategies I'm using for myself right now, or trying to institute for myself, is sort of, you know, if it's waking up at a certain time, kind of keeping as if I was going into the office like I was prior, or if you were going to your co-working space, or if you were, you know, we still have our meetings and things like that still are taking place. So setting some type of routine for yourself, incorporating some time, some downtime as well throughout your day. Take breaks throughout the day. One of the biggest challenges is a lot of times, especially now working from home, is we sit a long time. So setting a timer for yourself, whether it be a 25-minute timer. So at the end of that 25 minutes, you get up and stretch, or you get up and take a walk around your, now home, or take a walk around the block, go make yourself some tea, get some coffee, get some lunch, still drinking your water, still making sure you're eating your meals, spending time, checking in with a friend or family members, things like that. So just these small little things can really make a big impact. They don't have to be these huge. I think when we think about or talk about self-care, we think it's taking a 2-month-long vacation off on some deserted island. Like, it's just those really small things you do every single day that can really add up and make a difference. Whether if you're into meditation, my favorite are these meditation apps, as I listed in the article, that you can kind of tap into 10, 15 minutes. Maybe you start your day with it, or maybe during the day, if you find yourself getting wound up, or you're really I think everyone right now is just really stressed out. Everyone's really stressed and really anxious. There's a lot of uncertainty going around. So just taking that pause for yourself, popping in your favorite podcast, or if you like listening to music, just these things throughout the day can make such a big difference. Another tool is stand up, create a standing desk for yourself, a pile of books or a box, set your laptop on top of that, stand, you can do a couple of exercises while you're standing that helps to change, scenery or just change the feel. Because, for me, it used to be, I'd go work when I wasn't working at my office, go working at my favorite coffee shop. You can't necessarily do that anymore. So maybe it's creating a space in your home, or, just working instead of your coffee table or kitchen table, go work at the kitchen counter, or if you have a small outside, or if you're lucky enough to have a backyard area or a deck or a small apartment balcony, go sit outside and work outside for a little bit, just to sort of switch up, the day-to-day and the routine. And also be patient with yourself. I think that's also really important. Especially now, I think right now, there's a lot I've seen so many things about use this time to be working on your business, to learn this language and read all these books and write all these posts that you've been wanting to. If you don't get any of that done, that's okay too. That is totally fine. Every day is not going to be some super productive day, whether we're going through a crisis or not. And it's okay if we don't have a productive day, right? Don't feel the need that you have to be on this constant wheel going all the time, because guess what? That leads to something we like to call burnout. And then you just find yourself in this rut, and then it's really, really hard to get out of, or worse, right? It leads to a whole lot of other health issues. So just really being patient with yourself. If you're a person who is an early bird and you work better working super early in the morning, then that's for you. If you are a night owl and you feel like you work better later hours, use that time. Use sort of how you work and what benefits you best to be able to continue going and continue moving. And again, as I mentioned, a lot of us, again, if you're taking care of family or kids and you're and running and you're trying to, a lot of people right now are managing homeschool and managing work, and I feel like we are doing so many more meetings, and everybody wants to check in. There's nothing wrong with checking in, and we should, but it's also okay to say no, or I need a break, or I need rest, or not today, let's reschedule, when you can. So just really, I think, and for me, again, it's sort of the example I follow for marathon training. And, it's important to have a plan, and I know what I need to do, or how many miles I need to run for the week or for the day. But sometimes I had to make adjustments because of, work ran over, or a meeting ran over, or I now have to travel or be somewhere else. And so just being flexible and adapting can be really helpful as well. So just, as I say, especially right now, breathe, be patient, be flexible. And also one of the other biggest thing is minimize consumption, news consumption, media consumption, stop the scrolling for a while. After a certain amount of time, especially because of the field I'm in, I turn off the news. I have, my fun group chats and stuff. If they're talking a whole lot of, the worries of the world and I know it's going to stress me out, I'll go back to the group later. Like just really setting those small little boundaries for yourself when you can is just so important. And everybody wants something from you right now. So it's just kind of being like, look, if I need, can you get this done for me? No, I can work on this, but I may need a couple extra days. Again, if it's your day job, it's a little different, but when you, within reason, like if there's something and you're really being asked about your time frame, actually I can get this done in this time frame, don't overcommit. I think that's also a challenge, and I've had to learn that for myself of overcommitting, because there's that, especially as an entrepreneur, especially if you're a newer entrepreneur, you want to bite and get every opportunity that you can, right? Everything that's presented to you, everything that's come, I've got to get myself out there, got to say yes to everything. You don't. If it doesn't align with your work, or it doesn't align with what you're doing, or it's not going to help you in some way, it's okay to say, to pass on that. So, and only you can really make that decision for yourself. And I know, again, that fear of uncertainty and that fear of unknowing, or the fear of when is that next opportunity going to come, or I'm, if I say no, then I may have passed on this awesome opportunity. Another opportunity is going to present itself when it's right. So again, just be flexible, be kind to yourself, and be patient, and just, keep going, keep moving forward, but also just, give yourself some, have a little compassion for yourself too, as well.
Great advice.
Hey, thank you, Dr. Gray. You've been very thorough and helpful. I've been blown away with all the information I've received here today. Is there anything else that you want our listeners to know that we may have not asked already?
I think we covered a lot. I think, again, I think it was a good way to end on that note of just, I know right now is a really difficult time. There's a lot of uncertainty. There's a lot of fear. But as I mentioned, just, trust and know that you have people working on your behalf for you and your families and your friends and for everyone, and ensuring the health of everyone around us. And, just keep pushing, keep moving forward. But during this time, especially, just be kind, be gentle. And, we're going to get through this. And, it's rough, but it will pass. It will definitely pass.
Thank you. It was a great conversation. Yeah, one of the things that I definitely saw, so this is a more luxurious way that I probably have taken self-care, but I've seen, especially with my business, when I don't make time to meditate, to exercise, my therapist calls it my holding spaces. If I don't make time for those things, my business, everything in my life, my personal life, my professional, everything else is in chaos. Yes. But when I take the time, if it's 10 minutes in the morning to meditate, and then to journal or to exercise and to be with friends, I am a better professional. I'm a better friend. I think one of the things that I have also found that's been really interesting, and your article spoke about this, it's like, as an entrepreneur, you're not only an entrepreneur during like 8 to 6, right? Like all of these things flow into all of your other parts of your life. So you have to make time for yourself, and it benefits you long term.
It does. It's like my favorite thing that I go back to, and it's that cliche saying of, seriously, you cannot give from an empty cup.
Yep.
You cannot. If you are so drained, you have nothing. You have nothing to give yourself. You have nothing to give your work. You are not your best self, because you can't concentrate. You have no energy. You're not healthy. Your body is shutting down. Your brain, your body, everything just kind of it just comes to a halt. And so it's really important to just, again, there's nothing wrong with the hustle. It's very important. I get it. We all have livelihoods. We've got to take care of ourselves. But what good is any of that if you are sick or gone? You've worked yourself literally to the bone. And then you see it all the time. It's people who, you see it every TV show, every movie, or, those scenarios of these people who had it all, worked so hard and was so gung-ho, and then all of a sudden an illness happens, or or something just really dramatic happens that causes them to slow down. I've even had to tell myself just a couple weeks ago, I found myself sort of in this heightened state, and it was just like, slow down, where are you going? Like, where are you going? Like, just take a moment, and breathe. And I think the other thing we didn't touch on right now is a lot of people are grieving right now. Like, there's a grief that's happening that I think a lot of people don't have a word for it or don't understand, or they're dealing with a lot of us now are spending more time with ourselves. So it's bringing up a lot for people, and people aren't necessarily familiar with that when you have that quiet time, because we've kept ourselves so busy that when you have time, it's sort of the work is sort of a patch or a Band-Aid for that. I don't have time to think about that. I don't have time to be stressed. I don't have time to be, sad or grieving or dealing with X, Y, and Z. And so we just keep ourselves sort of moving forward, and we think that's actually beneficial when it's really not. So it's really important and you brought up, therapy. I urge everyone to go. And I am so glad that we are having more conversations, especially in communities of color, not just for women, but also for men, to seek out some type of care when you're ready. You have to be ready to enter into that process, because it is a process. It's not a patch, it's not a fix. And you have to be ready and willing to do the work. But it can be really helpful, especially during these times, or any times, or especially as an entrepreneur, because it is such a siloed sort of experience. Others don't necessarily know what you're going through. And I equate it to when I was in grad school going through, dissertation and going through that whole process. And I remember first starting my program and someone said, you'll get to the point where it's lonely. You feel lonely. It gets lonely because, people are like, well, why don't you just get it done? Or, why don't you just, and it's like, there's so much more to it that people don't always see. And, it's great when you have your cohort of entrepreneurs, or you have your cohort of fellow students, but then when people start to parse off, or, that changes, or their lives change, you have to be able to carry yourself as well. And so that's why the slowing down, that's why taking the time for yourself, that's why finding whatever it is. I like the gym and I like working out and I love running. Other people don't like it. That's fine. Find something that you love. I like to cook. I like to bake. And if you like art, if you like dancing, if you like music, if you like reading, if it's learning a new hobby, whatever it is, just find that thing for you. Because what it also does is, like you said, it helps to unlock creativity. I found that when I would take a step back and I took the pressure off of myself, that's when things come to me, and that's when I'm able to write things and produce those types of things. When I feel like I have to force myself to do it, it just doesn't work. Yeah,
definitely. I really enjoyed this conversation, Tiffany. Thank you so much for taking Saturday to talk to us, and I hope that you stay healthy and safe, and thank you for the work that you're doing.
Same to you all. Thank you so much for having me.
All right, take care.
Bye-bye.
Bye.
That wraps up this episode of the Disruptive Podcast by Minority Innovation Weekend. If you haven't already done so, please subscribe. Check us out online at www.minorityinnovationweekend.org and connect with us on Facebook, Instagram, Twitter, and LinkedIn. MIW 2020 is coming up on Saturday, October 3rd to the 4th, so head on over to www.minorityinnovationweekend.org and register for MIW 2020 today.